So our next speaker is Miss Teresa Dowsing. She is the Physician Associate, former President of Faculty of Physician Associates at Royal College of Physicians. She's going to share her experience of sharing the responsibility with Physician Associates. Thank you very much, Teresa.
Good afternoon, everybody. So my name's Teresa, and I work as a physician associate at the George Eliot Hospital. I'm honoured to have been asked to speak at what I think is your first conference here, so thank you ever so much for the invitation. I work very closely with Dr. Zaman on the acute medical unit at the George Eliot, and also Dr. Vinod Patel. I'm going to talk to you a little bit about physician associates in the UK. So we're relatively new. We've been around for about 10 years. And interestingly, from hearing about the last talk, we're grateful to be here from our American colleagues. So we actually had physician assistants from the States who came over to the UK to sort of try proof of concept about physician associates and whether they would work in the UK. So I'm very grateful for them for coming over. And a lot of them did actually go back to the States, sadly. Let me tell you a little bit about, has anyone heard of physician associates or physician assistants at all? Yeah, oh good, excellent, excellent. You're going to know all this talk then, so I won't need to say very much. So this is the sort of dictionary definition in the UK about what a physician associate is, and it's sort of a definition by committee, really. The things I'd like to highlight to you is that we are not doctors, so we are physician associates and we aren't replacing doctors. That's a very important point. We do work in the medical model, so we are trained at medical school, and we have to do a first degree, and then we do 2 years at medical school. So our first degree tends to be biological sciences or medical sciences based, and then we do 2 years at medical school. And it is about developing those skills, knowledge and attitude in order to try to help places like the NHS, where we've already heard we have a workforce crisis, and I work in elderly care, so I feel it more acutely than lots of people, especially older people coming through A&E. So we are there to try to develop those skills and knowledge and attitude in order to be generalists. So we're not specialists, we are trained in general medicine. And so what we are doing is providing that role of general medicine that we've kind of lost in the NHS recently. People have become uber specialised. So we work within the medical model under physician supervision. So PAs like myself have someone like Dr. Zaman or Dr. Patel, and we work very closely with them as our clinical supervisors. And when I first graduated as a PA, I never left the side of my consultant, and he probably wouldn't have wanted me to. But then as I've developed my skills in elderly care, I'd like to think after 7 years I'm quite good at it now. Because I haven't had to rotate, I haven't had to learn anything else. Elderly care is my bread and butter, and I love older people, so I just have a fantastic job. So over time, I've now got to the point where I lead a frailty team on our acute medical unit, working with colleagues like Dr. Salman and Dr. Patel, trying to give geriatric input. But when I first started, that wouldn't have been the case. So we do work within our sphere of practice and competence, but we are dependent practitioners, and we're definitely not here to replace anybody, because as we all know, there are plenty of patients to go round. So we take medical and psychiatric histories, we do all the sort of physical examinations that you'd expect, formulate differential diagnoses, look at what investigations we want to order, and then develop management plans within the multidisciplinary team. A large part of our role is about education and communication, so a lot of my role in elderly care is talking to relatives, explaining about end-of-life care, palliative care that people have already mentioned, in order to try to provide an all-round service and try to improve quality of patient care within the NHS. We also do the horrible stuff like taking bloods and putting in cannulas that is the least favourite part of my job. So as I've already said, you do your first degree and then you do 2 years post-qualification. When we set up physician associates in this country, we were quite clear that we had to have a national curriculum. So if you're a PA and you're training in this country, and at the moment we've got 1,000 students that are in training at the moment, this time last year we had about 20, we've sort of exponentially exploded really. So we wanted to have a national curriculum, so wherever you train you get the same curriculum, and also you have to sit the same exam. So it doesn't matter whether you went to Birmingham University or if you went to St George's, you will all sit the same national exam. So we've got this national standard. We also wanted to make our system robust in the fact that at the time it seemed like a good idea at the time, but we now have to resit our national exams every 6 years. So some physician associates are working in like paediatric surgery, but the role is still generalist. So we have to resit our general medical exams every 6 years. And thankfully I did mine a few years ago, so I haven't got to do it again for a bit. We aren't statutory regulated at the moment, but that is going through with support from the Health Secretary and the Department of Health here. So we are looking hopefully to have sort of statutory regulation in the next couple of years. It's something we've asked for the last 10 years. So at the moment you have a managed voluntary register that PAs are on, and that's held at the Royal College of Physicians. And we've actually got 30 PA programmes currently running in the country. So we're generalists, we try to improve patient care because we are focused on service provision. We do improve that continuity of care, especially on medical wards and surgical wards, because we are a key part of the team working with the doctors and the nurses and the healthcare assistants and physician associates and the other physician associates to try to improve care. And we have found at the George Eliot that it's helped us to stabilise our workforce. We were in special measures a few years ago. I'd like to say PAs rescued the trust out of special measures. We can't take all the credit, though I'd like to try. But it has really helped to stabilise our workforce for patients because it was quite scary before. And also what we want to do is to try and bring a new healthcare profession to the NHS. So rather than taking the best nurses, the best physios, the best of everything else, we've got science graduates that are really keen and enthusiastic about working in the NHS, even if they're a bit older like me. And we've got a lot to offer. So what we want to do is not to rob Peter to pay Paul, but actually to have new healthcare professions. And also we provide a lot of teaching for junior doctors and other members of the medical team, and teaching for consultants sometimes. And we can help improve care through quality improvement projects. That's been a bit of a whistle-stop tour of physician associates. We now have our faculty of physician associates based at the Royal College of Physicians, which we're eternally grateful for. We're trying to move towards statutory regulation. Jeremy Hunt, our Health Secretary, has said that he wants 1,000 PAs working in general practice in the NHS by 2020. And I'm hoping he doesn't mean that many physician associates that are unregulated. We're looking at expanding the number of programmes, but with that we need to accredit them, so that's another big part of what we're doing at the moment. Raising awareness of the profession, so being asked to speak at events like this is fantastic, so again, thank you very much. And as a role, and just from a personal perspective, being a physician associate I think is probably the best thing that I ever did. So thank you very much for listening. I think that was it.